I know I'm not crazy. But every day I have to come here and watch this clown show, man. Sometimes just can't take it.
This is Bill Duke. He is a seasoned actor, director, and producer of countless movies and TV shows that you have probably seen, playing opposite Arnold Schwarzenegger in movies like Commando and Predator, and he's even directed major TV shows such as Miami Vice, Hill Street Blues, Cagney and Lacey, and The Twilight Zone, just to name a few. He is an incredible voice for the African American community, even creating the Duke Media Foundation that prepares young people for a career in all aspects of film, video, and TV production. In this interview, he and Dr. Scholz are going to be discussing his prostate cancer case and the impact prostate cancer has had on the African American community and what African American men can do to take charge of their health. We hope you find this video informative.
I'm incredibly honored to have some time to spend this morning with Mr. Bill Duke. You just saw the amazing montage of his accomplishments, and I've also gotten to know him as his personal physician for a number of years, and also through a book that Bill came out with, his autobiography, and which I've enjoyed reading twice now, Bill.
Thank you very much. Thank you so much.
It's having written a couple of semi-technical books myself, I have a deep admiration for your writing ability and how you can move a story along so briskly and yet capture so much depth of meaning at the same time. And I highly recommend this book. It's very easy to read, but it really grabs your heart. And it's also helpful to get to know you a little bit better. You and I have known each other over 20 years as a physician and patient. And this is why we've asked you during Black History Month to please come on and talk a little bit about your experience with prostate cancer, which I think is not what people are going to expect. Most people hear the word cancer and they say, "Gads, get it out. Don't let it get me." And your status now has been on a monitoring process for more than 2 decades. And so I'm going to invite you to talk a little bit about your early encounter with this diagnosis, because you were very careful to check your PSA back then, which was sort of a new thing. And when it was found to be elevated, the prostate-specific antigen was a little abnormal. You pursued it aggressively, you got a biopsy, and then you got thrown into the medical system. And I think now I consider you a seasoned expert.
Well, first of all, thank you for having me on. I've been very, very fortunate for the grace of God and through knowing people like you to deal with my situation in a way that was, how can I say, when someone first says to you, when they do a biopsy, they found possibly signs of cancer in your prostate, your first reaction is fear. When I say fear, I mean, what did I do wrong, God? You know, it's like all kinds of things that come to your mind. I was at the top of my career and having a great life, etc. And suddenly this news comes. This was in 1994. And that's when I met you. And so before I met you, I'd gone to a number of different doctors, mostly surgeons. And they said, remove it, get it out, take it out. And I was going to do that. But fortunately, I was with a young lady at the time who was really into online research. And she says, Bill, why don't you just, I know you're going to have the operation, but before, why don't you see if you have any other options? When I started doing research, I realized that there was more than surgery. And that there was a difference between a urologist and an oncologist. No one ever taught me that either. I mean, we don't know these things. And so as my girlfriend at the time and I started doing research, we found a lot of how can I say, different results to different applications to having prostate cancer. And oncology really was the research aspect of it. In other words, people who didn't just operate, or there's nothing wrong with surgeons or anything, I'm simply saying that, but when you have people that study and analyze and really do research on the issue, it's extremely helpful because you're given comfort in the sense that you're not on your own. In other words, not just throw you in some place, deal with something. No. What is the history? What are your options? And that's something I did not have before I met my good friend here. And once I knew what the options were, he put something out there called watchful waiting. And watchful waiting was, let's watch your PSA. Let's see where it goes. Let's see what happens if you change your diet, if you exercise, there are a lot of things that you can do to possibly impact this. And thank God I met you, Mark, because this was in 1994. And I've not been disabled in any way by, my prostate. My career is still going, thank God. I've been with you doing, MRIs and whatever else is needed to keep watch. Without being long-winded, I just want to say to anybody who is facing this or who may face it in the future in terms of prostate issues, fear is going to hit you first. But once the fear has settled a little bit, do your research. And I think talking to a great oncologist like Dr. Scholz, who does not hold back, does not pull punches, gives you the facts and lets you know what your options are and that it's your decision. He's the doctor, but it's your decision. Once you're self-empowered like that, you begin to understand that it's in your hands. And so it has not been an easy journey because fear comes and goes, as you know, but it has been an enlightening journey in the sense that I do have options and have had them.
Yeah, and for 20 years, you have been in this monitoring position, of course, becoming more and more expert, continuing to study, and thankfully enjoying the relief that the shoe didn't drop. And when you started doing this, Bill, it was somewhat revolutionary. The standardized idea of watchful waiting, or we call it active surveillance now, was a very avant-garde idea. And obviously, I don't know if it's obvious. I think it's obvious to red-blooded American males. The underpinnings of this is that the threat with surgery is that you're not going to be able to perform sexually anymore. And forgive me, but that's just a big part of our male identity. And what a dreadful concept to sacrifice that for a condition that may not need it, something that is a low-grade process that is common in us guys as we get older. And I think this is so confusing that there are different types of prostate cancers, and as you studied over the years and as I studied over the years, we learned that there are types that are pretty common that don't spread. And that ability then to go slow and watch it, you mentioned getting MRIs, has opened up this possibility for men to be in the medical system, but not be misused or abused by an over-aggressive surgical approach. And thankfully, the other treatments, if a treatment becomes necessary down the line, the technology is getting better every year. So the men that postpone treatment can anticipate a less toxic and more effective treatment as time goes on. So thanks so much for sharing that. I think you give me a lot of credit, but when this started, Bill, the idea of active surveillance or watchful waiting was really only reserved for older guys. and you being a younger man, we were sort of reapplying that thinking, but stepping out on thin ice. And it was your boldness and courage, because, and that's part of it. It sounds so laudable that I'm giving you the choice, but honestly, I'm sharing the risk with you because there was some uncertainty in this. But we knew that if surgery was done, that you were going to be taking a tremendous risk that you'd never be able to be a normal sexual being after that, which is a very daunting prospect. And so I think that it's kind of you to give me so much credit, but I think it was you talked to a lot of different doctors through this process, and you have always called the shots. You've used me as an advisor, but ultimately it's been your call, and you called it right. Here we are more than 20 years later, and you're in a great place.
I feel very, very fortunate. And God has guided me, and friends and you, and, doing the research, etc. And yes, losing my sexual abilities was a major consideration also, I have to admit that. Yep. And I'm glad I made the choices that I made. But I'm going to go back and to men and or women who are diagnosed with any kind of cancer. In the beginning, you're going to be hit with fear. Mm-hmm. The C word is something that nobody wants to hear. It's something that automatically you feel you're dead. And it's only a matter of time, etc. But that's not always the case. And it's really in your hands. And a lot of it, and I know that sounds crazy, because you're told so many different things. You can't do anything, it's too late, or blah, blah, whatever it is. But when you start taking control of your own life and taking responsibility for your own life, you're responsible. And for you to do the research, for you to take your time to love yourself enough to do what you have to do to survive, not only survive, but to enjoy your life. It takes work, it takes research, it takes support from your family and your doctors, etc. But it's worth that journey. And so I know fear is going to hit you first, but once the fear subsides a little bit, research and investing in yourself in terms of research is so important. And today, that was 1994. People today have access to the internet, which was barely stable at that time, and social media and being able to do research online, all of those things. Today, you have tools which did not exist as much 20 years ago. No, more than 20 years ago, 30-some years ago. So I'm simply saying it's hope. It's hopeful out there now. When this first happened for me, there wasn't a lot of hope. Your family, your friends, everybody except a few people said, get it done, take it out, whatever it is, just get rid of it. Well, I know they were well-intended. I still love them for today. But that's advice I'm glad I did not follow. And so, yes, you take a risk, you take a chance on you, but it's you taking a chance on you. And I was very fortunate to have Mark around and to advise and to support, and other family members also, but I'm just saying you have options. It's not just one way, you have options. So please believe in yourself enough to really examine the options.
Yeah, I like how you say believe in yourself, Bill, because the medical system is very powerful. A lot of highly trained, intelligent, articulate people that are rushing around, doing their thing, telling you what to do. And it's easy to assume that you just don't know enough, you don't have the mental capacity, or that you're not really qualified to make such decisions. And I remember the process you used, because you were very humble about the process, but you would go and talk to different doctors, and then you'd match what they were saying with each other. And it took time, and sometimes people think that the clock's ticking, this is cancer, I got to get it out. Fortunately, that's really never the case with prostate cancer. It is true from some other types of cancers, but not prostate. And you were patient enough to go and talk to top people and listen and wait. And then when it was time to make a decision, you had the courage to trust your own conclusions, which I think is essential now. In this modern era, more than ever, things are moving so quickly. New things are coming out all the time. And we know that the doctors can't keep up with all this stuff. It's not they're bad people, it's just that they're stretched so thin.
Hi everyone, this is me and Hunter. No, we did not name him Prostate or Gleason, but thank you so much for your comment recommendations. Well, we're just here to say subscribe to our YouTube channel. You want them to subscribe. Yes, you do. And visit our website, PCRI.org, for more information. We hope you have a great week.